पढ़ने वाले हैं इंग्वेनल कैनाल. Inguinal canal is an oblique intermuscular passage in the lower part of anterior abdominal wall, which is parallel to the inguinal ligament. Inguinal ligament is the one ligament that extends between the anterior superior iliac spine to the pubic crest. It is parallel to the inguinal ligament. This inguinal canal is 4 cm long and directed downward, forward and medially. Downward, forward and medially. It is formed due to the descent of testis ovary into the scrotum and pelvis respectively during fetal development. This main content of inguinal canal in male is spermatic cord. In female it is round ligament. Inguinal canal extends from deep inguinal ring to superficial inguinal ring. It has 4 cm. It is 4 cm in length. It is marked by 2 parallel lines just above the medial part of inguinal ligament. The deep inguinal ring is marked 1.2 cm above mid inguinal point, 1.2 cm. That is deep inguinal ring, and the superficial inguinal ring is marked just above the pubic tubercle by the triangular at the end of parallel lines, medial end of these parallel lines. Deep inguinal ring. Deep inguinal ring is an oval opening. It is at 1.2 cm above to the mid-inguinal point, and from its margins the fascia transversalis is prolonged into the canal like a sleeve. The internal spermatic fascia around the structure that pass through the ring. This is the structure which makes the spermatic cord in male. Superficial inguinal ring is triangular gap in the aponeurosis of external oblique and lies above and lateral to the pubic crest. This is a triangular opening in which pubic crest forms the base, and two sides are called crura, which meet laterally to form an apex. Near the apex, two crura are united by an intercrural fiber. This is a triangular in which base is formed by pubic tubercle, and both sides lateral are called as crura, which are meet at the apex by the intercrural fiber. It is 2.5 cm long and 1.2 cm broad at base. It is at 1.2 cm and 2.5 cm long. Structure passing through the deep inguinal ring. In male and female there are difference in the structure those passes through the deep inguinal ring as well as in superficial inguinal ring. In deep inguinal ring, in male, ductus deferens and its artery, testicular artery and its accompanying vein, and genital branch of genital femoral nerve and lymphatics. In female it is round ligament, genital branch of genital femoral nerve and lymphatics in deep inguinal ring. In superficial inguinal ring, in males, spermatic cord, ilioinguinal nerve. In female, round ligament, ilioinguinal nerve. Okay, now boundaries. This inguinal ring is medial, forward and downwards in body. So these sides parts are considered as anterior and these sides are considered posterior. Anterior, it is by skin, external oblique muscle, internal oblique muscle. Posteriorly, it is by transverse fascia, fascia transversalis, conjoint tendon. Once again, anterior wall, it is formed by superficial to deep by skin, external oblique muscle, internal oblique muscle fiber, in lateral one third internal oblique muscle fibers, posteriorly by fascia transversalis, conjoint tendon, and reflected part of inguinal ligament medially. Roof, it is formed by lower arched fibers of internal oblique and transverse abdominis muscle. In this type, roof is formed by internal oblique muscles, transverse abdominis, external oblique muscles, fascia transversalis. Roof is formed by inguinal ligament, and spermatic cord is a content of inguinal canal. Clinical application: inguinal hernia. It is a protrusion of abdominal contents into the inguinal canal. There is a video in a playlist in which I have explained inguinal hernia as well as femoral hernia and a case study. Please go through that.